Dr. Tom O'Brien, thank you so much for lending your expertise to our knowledge base on mold. I'd really like to pick your brain today on inflammation and, mold being a driving factor for inflammation, but how people actually get sick, if you could elaborate for us.
I think it's such an important concept for everyone to realize. Doesn't have to be geeky, it just has to make sense to people. That the CDC tells us that 14 of the 15 top causes of death in the world today are chronic inflammatory diseases. Everything except an unintentional injury, an accident. Everything else, Alzheimer's, diabetes, heart disease, arthritis, multiple sclerosis, rheumatoid, they're all chronic inflammatory diseases. I consider it the root mechanism of disease. Some doctors talk about root causes. Oh, this is the root cause. No, it's not. There are many causes. Some are more prominent than others, but there's one root mechanism for over 95% of the diseases that we get. So if we understand this root mechanism and we begin to look at why is that happening to me, then we have the power to make some different choices. Because if people are suffering, obviously they have some type of inflammatory cascade going on. There's lots of inflammation in the body, and we can give some examples if you like. But it's inflammation. Now, where does inflammation come from? Inflammation is the response of the immune system. Our immune system is the armed forces in the body. It's the Army, the Navy, the Air Force, the Marines, the Coast Guard. We call them IgG, IgA, IgE, IgM, cytokines. There are many different branches of the armed forces, but it's the armed forces. It's there to protect you. And it never argues. I've got a slide of looks like a special forces guy all dressed up in a helmet and goggles, and he's jumping out of an airplane, and you're in the plane and you can see the clouds and the earth way, way down there. And he jumps out backwards and he's saluting. It's just a great photo. But the immune system never argues. It'll do everything it can to protect you. That's why humans have survived over the centuries, the millennia, is because we've developed an immune system that will protect us without negotiation. It never says, I had a couple too many beers last night. I'll get around to this, but I need a break. It never does that. It will always do whatever it can because it's saving your life. And when you understand that, and you understand that the inflammation in our body is the mechanism by which the immune system tries to protect us, then the $1,000,000 question is, what is it trying to protect you from? And the most common, one of the very most common environmental triggers, I see it every day, most, not quite, but most every patient is some degree of mold exposure. Along with they might have a gluten sensitivity, they might have some other food sensitivities or heavy metals or all the other lipopolysaccharides, all the other stuff that might activate the immune system, but mold is so very, very common. That's why I'm thrilled to be here with you, because it's such an important message to get out to people who think, oh, I don't have any problems with mold. You don't know unless you check. And the rule is, in God we trust, all others require data, right? So you just have to check, and you have to check properly with the right test to see, is this a contributor to the amount of inflammation?
That makes me think of Richie Shoemaker's work, chronic inflammatory response syndrome, which
Right.
it's named for its mechanism,
That's
which
right.
is what you're talking about, the
That's right.
inflammation.
And no one can argue with this basic concept. It's so simple that, and we've gone through all of our education, our medical education, our years in practice, we get so laser focused on some things, we forget the big picture. And the big picture is, why is that patient inflamed? Because it's always inflammation causing their recurrent miscarriages, or causing their migraines, or causing their joint pains, or their whatever it is. It's always infl- 95% of the time, it's inflammation. So when we can investigate what is my immune system trying to protect me from, it changes the paradigm. It changes how you approach whatever symptoms you're currently having.
Yeah, so aside from food, you mentioned gluten earlier, and so many people struggle with autoimmunity, and gluten is one of their answers. We've talked about this for years, but where would you put mold in this equation and other associated water damage building byproducts?
That's a really good question. I've never thought of it that way before, and there is an argument to say it is right there with wheat related disorders at the very top, or it might be above wheat related disorders, because we know every human responds to wheat with an activated immune system, but for some people it doesn't cause any trickle down damage. It depends on how inflamed they are and how much damage has occurred to their tissue and their microbiome and a lot of things like that. But mold is so stealth. It's like a stealth bomber that no radar can detect. You can't detect that you've got a mold sensitivity until you've created so much inflammation. Now your tissue can't function properly, whether it's your brain or your eyes and your vision or your liver and detoxing, depending on where the mold is accumulating and what the inflammation is addressing. So it's right at the top. There's a couple of tests that I require before I'll talk to a patient. I won't even talk to them, because I see one patient a week, one every 2 weeks by Zoom, and my job is to identify why are they still sick, right? And so we're going to do a bunch of tests to identify the mechanism that's going on for them. Where's the inflammation coming from? I won't talk to a patient if they don't include a test for mold, because it's so very, very common. I don't care if they say, well, I don't have any mold. I checked my house, I don't have any mold. Okay, but we're not treating your house. We're treating you. And if you live in New Orleans, but you've had your house remediated and everything's great, or you live in the South in Texas, and your house is safe, but you're not a hermit. You've got a car, and you're breathing the air coming out of the car. You work somewhere, you're breathing the air there. You go to restaurants, so you can be getting the exposure somewhere outside your house, but on a regular basis. So you go to church once a week, and you're inhaling it for an hour and a half when you're in church. I live in Italy now, and so I like to visit some of the old churches, when there's no service going on, just to see the architecture and the paintings and all that. And some of them, I walk in and I go, no, and I turn around and I walk back out. I won't go in, because I'm not going to stay in there for 10 or 15 minutes breathing the mold. Same thing, I think we've talked about this before. We travel so much, and you fly to a city like we're here now in Niagara Falls, right? You fly in, you take an Uber to the hotel, you check in, you go upstairs after a long flight, long day, put the key in to open the door. The first thing I do, I leave my bags out there in the hall. I walk in, close the door. No. And I said, really? Oh, come on, because I'm tired, right? But I go back downstairs, say, hi, I need another room. There's some mold in that room. That you have to be vigilant of your exposures once you've identified that this is a contributing factor for you, creating the inflammation that's producing the symptoms you've got.
Yeah, absolutely. I find that when many people are exposed long enough, they become so hypersensitized that even small exposures here and there can really set their immune systems up for reactions.
Right, that the immune system is so vigilant now that it's just a minor little exposure in the Uber car, maybe, but it's enough to create a cascade effect. It's like if you're exposed to gluten when you've been gluten-free, a single exposure, and you're going to have an immune reaction for weeks from one exposure. And I haven't seen the science on mold to say that same thing, but clinically, that's my experience, is that people can have symptoms that'll linger, and they're not sure why. I said, would you go to a new church, or in my example, that they've gotten some exposure somewhere.
Yeah, what percentage in your clinical experience of people that you've treated with autoimmunity where mold or mycotoxins or LPS from the bacteria that grows with mold, what percentage would you say of those individuals have those specific types of problems?
100%.
100%.
I've never gotten a normal back on a first test when I'm looking for someone. I'm looking for the triggers of inflammation for someone diagnosed with an autoimmune disease.
So very specifically, not normal people with great health, but people that have a prior diagnosis, somebody with rheumatoid or multiple sclerosis.
Right.
Or
I thought that was the question, and people
Yep.
that come in, yeah,
Yep.
yeah, every single one of them.
And in your experience, I don't know if you've quantified it in any way, at least clinically. I know sometimes it's hard to do. How much, like if we were saying, okay, gluten was 20% of why they got sick, and maybe heavy metals were 20% of why they got sick. What percentage of trigger would you say mold, mycotoxins, LPS are? I know you find it in 100%, but like in changing somebody's diet, my experience has always been, a lot of times they get better.
Mm-hmm.
And we don't have to go farther than that.
Mm-hmm.
But
to a degree,
yeah,
they get better.
yeah,
Mm-hmm.
yeah. But I guess what I'm trying to ask is quantitatively, how much of it is that environmental piece for people?
I haven't evaluated that on a large group of patients. I haven't thought about it. Your question is a good one, and my response would be every single one of them will have an immune system that's fighting mycotoxins. And the test we use looks at 28 different mycotoxins. Every single one will have one or two. Some of them will have 10, 15 different mold mycotoxins that their immune system is fighting. And if I look at wheat, we use a test that looks at over 20 different peptides of wheat. And okay, so which one has more variability of components of mold, components of wheat, which one is a little more dominant? And I haven't thought about that before, so I'm not sure it's accurate, but my experience, off the top of my head, mold. Mold is more common than a sensitivity to wheat in terms of how aggressively the immune system is fighting it.
In your experience, what do you feel like is the biggest commonality behind how people are exposed to mold? Is it their homes, churches? Like what are you seeing mostly?
Mostly their homes. It's extremely rare to not identify the source in the home if they look thoroughly enough. Mostly in the home. Some it's foods, for some it's coffee, because the beans they're using have mold in the coffee. And it's minute exposure, but if you're drinking coffee every day, 1 or 2 cups a day, you're getting a little bit accumulatively that builds up in your body, an exposure to mold. But mostly, I think it's the home environment. That's been my clinical experience.
Yeah, I ask because so many people, like you said a moment ago, can't be in my home. I don't see mold on the walls.
Right.
I'm a super clean housekeeper. There's just no way mold
Right,
is
it's
growing.
offensive to them to think
Yeah.
I've got mold. Really?
Yeah.
Let's just take a look in your shower. You see that dark stuff in the grout there? It's like it's not white anymore, and you see it's dark, 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 and then it's white over here, and then it's dark again. You need to check that. That might be mold, right? That is so common to see, and I agree with you. I think some people think it suggests a dirty home, or you don't take care of your home. One of the questions I ask is, Mrs. Patient, if you go on a holiday for a week or 2 weeks, when you come back home, do you have to open the windows to air the house out? Oh yeah. Well, that's mold, right? You shouldn't have to air the house out. It's nice to open the door to get some fresh air in there, but we say, there's a noticeable difference in the quality of the air. That's likely mold.